everyone, my name is Nina Sesto. I am a CEO and co-founder of MEGI. Actually, my background is in molecular biology. I did my PhD at Pasteur Institute, and for 7 years I worked on RNA-mediated gene expression regulation and CRISPR elements. My work was published in multiple papers, including Nature Microbiology. I received the Jacques Monod Prize for Research in Medicine granted by French Foundation. And this was really very exciting part of my life, exciting scientific field with 2 Nobel Prize winners with who I had opportunity to work with. But you see, I had this parallel life, parallel vertical that's been there practically since I was born, because I'm coming from a family of doctors. And my father was one of the pioneers of interventional cardiology in Europe. And he founded a clinic with the vision to unite everything from non-invasive diagnostics to interventional cardiology, electrophysiology, cardiac surgery, vascular surgery, everything under the one roof, in a patient-centric way, so patient is taken care of. And even though, we are talking about cutting-edge clinical practice, but coming from those 2 worlds, I was always perplexed with this huge gap between them and between what we are doing in the lab and what is happening at the patient bedside. And moreover, stunned with, public health problems and how people are dying. On one hand, we spend a lot on research. On the other hand, people are dying because of banal reasons, such as 50% of them not taking their medications as prescribed. So I wanted to go beyond the lab. And I did an MBA at HEC Paris and Wharton Business School, which definitely opened my horizons. But the life-changing experience was a consultancy project we did for Harvard Medical School and Dana-Farber Cancer Institute, where we analyzed how to introduce cancer research and treatment in sub-Saharan Africa. And based out of Senegal and Ghana, I studied how to use technology, innovative technology, to help those countries leapfrog and overcome major infrastructural gaps and know-how gaps. And that was my switch from molecular biology to digital health and artificial intelligence, where I fell in love with those tools because they are just magical. Magical in the sense of the impact and how they can scale and increase access to medical know-how and to healthcare. And I'm still excited with this feeling, zooming out from studying one molecular mechanism and affecting expression of one gene to really using a technology to impact a population, to impact millions of lives. With basically technology that is cheap and accessible and can be installed on your phone. And this was the aha moment for me when I decided to go back to my country. I joined my father's clinic, and today I use it as a digital health lab. And we developed MEGI there. We have access to more than 20,000 patients, clinical environment, infrastructure, data, doctors, processes. We can test, we can experiment on a daily basis. Because I really believe that's a path to successfully developing health tech, connecting science and innovation on one hand, and clinical practice and established workflows on the other hand. And my background allows me to connect those 2 different worlds, at the same time understanding how to enforce that with a sustainable business model. So with MEGI, we help more than 500 million cardiovascular patients to self-manage their cardiovascular health, leading to better prevention, early diagnosis, and their peace of mind. Once again, I'm honored to be part of this competition, and I'm very excited to show you what we do at MEGI.